Thanks once again for your company. Now, the Director General of the Ghana Health Service, Dr. Nsiah Asare, has assured the government is committed to completing the 43-year-old abandoned project at the Gov't Teaching Hospital in this current term of the NPP administration. Now, representing the Health Minister on a national conversation premised on Joy News' special assignment documentary dubbed Next to Die, Dr. Nsiah Asare said governments have made budgetary allocations towards the completion of the project, except that those funds have been inadequate. He's, however, certain efforts are rife in completing the project soon.
The hospital we earmark funds every year for the budgetary allocation. You see, I cannot complete my statement by not saying that since 2009, no money has been allocated. That's what I'm saying, that you see, Ghana government has a lot of things to do. So if you want to finish a project, which is not loans, then you have to, as a government or as anybody in authority, to put budgetary allocations for it, and then hoping that within the next 2-3 years it will finish. We are all not, you see, the reason why I'm saying is that you see, it was a commitment which was made by President Kufuor, and I was part of our policy statement and policy documents in health. This building, we are committed to finish it within this term of this NPP government. And maybe people don't know, only last week, exactly a week ago, a group of people came here. Now we know that we should have extra budgetary allocation, what we call earmark funds, which maybe you have to take a loan or we do something. We send people came here. People are now knocking at our doors that they want to come and finish this. You see, if you want any loans or anything to finish this building, because the building is already about 60% complete, it becomes difficult because anybody who is coming to bring money wants to bring his own contractor. But this is a group, about 2 sets of people who have come, and they have come to have a look only last Tuesday. I'm not too sure if they passed through the administration. I'm aware because I'm in Accra and I know what is going on. So what I want to
take it that, could you, just before you come in, do I take it that there was a break from 2009 until very recent because there was a change in administration? I know you don't want to go there, but can I just stay there for a while?
To be honest, I think it's actually a pity, Mama V, that we are making that the problem? Issue.
Yeah, let me tell you something. In 2009, there was supposed to be a 10 million from National Health Insurance Authority.
$10 million?
10 million Ghana cedis to continue with this building. I was here till September, August when I left.
2009,
yeah, 2009. Same
okay.
Year. I don't believe the money came. And then later on in 2013 or so, there was part of the oil money, which we call ABFA money, which was supposed also to have been used to also continue, maybe complete this building. I don't think it came. So as I sit here, I can tell you that I have not seen any serious work on this building since the change of government in 2000. That's why I'm telling you that, you say we shouldn't go there, but I'm telling you that we are so committed, because I'm part of it, the system. We are so committed as a Ministry of Health to complete this building. I'm just from budget here, a budget meeting only on last Saturday. We are going to put in money to complete this building, because let me tell you something. If you have this building from 1974 when the sword was cut, up to today, and we are not using the building to save lives, as the man and the woman came here to say, that because of congestion, there's infection, there's cross-infection, all these things, then there's no return on investment, period.
Victims of the dreadful ordeal resulting from congestion at the mother and baby unit of the Gov't Teaching Hospital in Kumasi have been impressing on government to finish the abandoned 43-year-old expansion project at the country's second biggest referral hospital. In very heavy emotions and uncontrollable tears, 2 of such people have been telling Joy News how devastating the experiences at the current facility has been. The mother and baby unit in our latest documentary dubbed Special Assignment Next to Die and now records 4 baby deaths daily.
When I get pregnant, I get the gestational diabetes. So I thought that the baby had also gotten it. But the doctor said, no, the baby got bent. I said, why? What happened? Because I heard you tell the nurse not to give the baby a bath. I said, well, I don't know. The nurse gave the baby a bath, and now the baby got bent. So I had not seen my baby since Wednesday. So Friday, meanwhile, I had gone through cesarean section. So Friday, I had to make my way to the MBU. So you could imagine, with all the stitches and everything on. So at dawn, I got up and came to the MBU. It was tears all over. I couldn't just open my eyes. I sat, when I got in, I asked the doctor, Dr. Planche, and she told me they had taken the baby to the Benz unit for dressing. So I waited. In about 30 minutes, I saw them pushing an incubator, and they showed me my baby. And the baby had been bandaged from neck to the waist, all arms bandaged, and had Vaseline all around over the head and the ear. So they took the baby in.
And this is how old? The baby at what age?
The very first day. This happened the very first day I gave her. So it was like the second day after birth. Yeah. So I had to breastfeed the baby. I took the baby out and had to breastfeed him. Like I said, the place was just too much. Getting even a chair to sit on to breastfeed, because mothers are there breastfeeding. But because of my condition and because the thing happened in a doctor, in the hands of a doctor who works at Confanoche, maybe I don't know whether that was the reason they were, I don't know what to say. Because like I was giving some preferential treatment because the thing happened in the hands of a doctor who works here. So I had to breastfeed the baby. I had to stay throughout the day. There was nowhere to rest. I had to sit throughout. Sometimes when I'm tired, I had to just come in front to where the nurses sat to rest. You would have no place to lay your head. I had to be with the baby throughout. And the doctor said the baby had to be breastfed because of its condition. It has to be exclusive. So I waited, and you know, MB, you go there, in every 3 hours, you need to go there and breastfeed your baby.
That I went, I couldn't see my baby very well, to the extent that the court that was supposed to take about 3 babies, I had about 8 of them. So
including yours?
Yes, including my baby. So I started murmuring. So, is that a situation here? So I went out that particular period while the baby was at the court. So I went to where my wife was, and I asked whether he has gone to see the baby. He said, no, he has not, because of the cesarean section. Fine. The next day, only to be told that my baby has had an infection. So I do not understand that why an infection. So that is the situation here. So Master, there is nothing that we can do unless we treat the infection. I said, well, I have no option than to accept.
So at this point, the baby was still sharing the court with 7 other babies?
Yes, yes. And besides, they suspected that the baby may be diabetic because of the weight. That's what I was told. Yeah. So the baby may be diabetic. So the next day that I was told that the baby has had an infection. So there was the need for them to treat. So I was there every morning, every evening. So the 5th day, I asked the condition of the baby, and the doctor told me that there will be a possible discharge of the baby. So
the baby
that
was getting better.
It's getting better. So that very day that we were discharged, we came home. That midnight, I traveled, only to be told the next day that, gentleman, your baby is no more. I couldn't believe it. The mother, because of the stress, the experience that the mother has had there at the MBU, she also had an infection as well. I think that was the 3rd day. So when I came the following day in the morning, I couldn't see her very well. She looked pale. I mean, the demeanor was not the best. So she was admitted. So you can see the mother is being admitted, the baby as well being admitted. So they wrote a medicine for me to buy for the baby and at the same time, the wife. So I came down to buy the medicine. To be frank, Kwaju,
and we sincerely apologize. You're having to relive this rather sad experience. This is third time referral to Komfo Anokye, and the experience is almost the same. The narration is the same. I don't know how you feel, Mrs. Arthur, when you hear, Mr. Ansah share this experience that he's had to relive. This is the third time.
Okay.
Sorry. I apologize.
Yes. I will. Yes. Yeah. Okay.
How does it make you feel?
All right.
I'm already in tears because I know what it is. I felt it. Though my baby, I did not.
Really sad scenes there from the Komfo Anokye Teaching Hospital. And just to let you know that tomorrow, the special edition of the Super Morning Show and the AM Show will be brought to you again from the Komfo Anokye Teaching Hospital. Now, this project is result-oriented, and so we are having this conversation with the hashtag Finish This Now, and it's a plea to all stakeholders to have that 1,000-bed capacity was started in 1974, completed so that these needless deaths can be avoided. Away from that, some 400 teachers from 4 districts in the Greater Accra region have vowed not to leave the premises of the Accra Metro office of the Ghana Education Service unless their salary arrears are paid. The teachers who have been trooping to the GES office for weeks and months tell Dawn News some of them have not been paid their arrears for 4 years. For a better understanding of the issues, I speak to one of the teachers, Norbert Otto, who is currently at the GES office. Good afternoon, sir. Thank you for your time.
Yeah, good afternoon.
Right. What reasons have you been given for the delays in the payment of your arrears?
Okay, for mine, it has been a year now. But the other teachers here, who has been over 4 years now.
What are the reasons being given for the delay?
Nobody has given us any reason yet, but today we were supposed to come here to negotiate for the arrears. That is, we come to check if our names are here, then we see auditors, then they start the process from there. But it looks like majority of us don't have our names on the list, including myself.
Interesting. So what does that mean? It means your name is not on the list, and so it means that according to their data, you don't have any arrears to be settled.
According to their data, our names are not there to be processed for an arrears that we are supposed to pay.
All right. Now, and Norbert, what I find a bit intriguing is that you are being told to renegotiate your salaries. Why is that so?
I can't hear you, please. Come again.
I'm talking about you being asked to renegotiate your salaries. Why is it so?
Because, the system is that if you are employed, for some time you are paid your 3 months salary, then the rest of the months that you haven't been paid, you have to come and apply for you to pay, which is a bad system, which was implemented some years ago. So that means all the teachers that are here to fix for the arrears were part of that new system that was dealing with people applying for the arrears. So we are here to check for our names. The information came in 2 days ago that we are to come here to check for our arrears. And I tell you, there's a whole lot of people here, over 300 to 400 teachers here. Just imagine the children we've left back in school. Who is going to take care of them? They are going to lose. So if this system is what we are going through, that means always we'll be coming here to negotiate our arrears. We, those whose name are not there, it means you have to go through all the process again. So if the person started the process 4 years ago, that means the person has to start the process again. So just imagine, it's our money. We are entitled to it because we work for it. So we need to be paid.
All right, Mr. Otto, let's talk about how far you've gone with negotiations, and if any of your colleagues have received their arrears through negotiation.
As a new teacher, I don't know how the negotiations are done through our representatives like NAT and NAGRAS.
Okay.
But since it is our money, we don't see why we should negotiate for it. Because we've worked for you. and in your system, you know we are on your payroll. So why do we have to go through a heck of I don't know what to put it, but why do we have to go through some process again to get our own money that you have to pay to us? It's really frustrating. All of us here have gone through the process. Come and see how frustrated we are here and stranded. Okay,
so let's talk about if any of your colleagues have been settled. Do we have any of your colleagues who have received their money so far?
Well, some are saying they have received yes. You know, I can't look at somebody's payslip to check if the person has received yes or not.
All right. Okay. Thank you.
For those who are here today, we haven't received any of these arrears that we are supposed to receive.
All right. Thank you very much. Norbert Otu is a teacher who has joined some other 300 teachers to protest, if I should put it that way, their salary arrears they want government to pay. And now still on the educational sector, Ghana National Association of Graduate Teachers has described as worrying teachers' inability to update their next of kin in their pension schemes. Shanti Regional Secretary Charles Kofi Edum-Inti observes the situation has resulted in unnecessary delays in fund disbursement after a contributor's demise. He was speaking at a Tier 2 pension sensitization workshop in Kumasi. Kwesi Debra reports.
The workshop afforded teachers the opportunity to know more about the Tier 2 pension scheme. Mr. Edum-Inti says holders on most occasions make their mothers or siblings next of kin, but says beneficiaries, especially wards, struggle to access funds in the event of death.
Also take note of the fact that they have to check and update their next of kin, because many of the teachers, especially when their new appointments have been given to them and they are asked to fill SNIT forms, they are youthful. Some of them as young as 22, 23. They don't have wives, they don't have kids, so they ask their mother to become the next of kin. But in the course of people forget, they are completely oblivious of the fact that even when the mother is dead, it doesn't actually, occur to them to go to SNIT and make sure that they update their next of kin. It's a very, very serious matter. So that when eventually the teacher, I'm saying that the unfortunate happens, the teacher dies. You understand? Then the man who is supposed to be the next of kin himself is dead. And that would become a problem. But in the meantime, the contributor had given birth to children who are underage and need some money to support them for their education and health and all that.
Public sector workers in the past embarked on strike over the non-payment of the Tier 2 pension contributions to their respective fund managers. Chief Executive Officer, Pension Alliance Trust, Dela Zumanu, assured the association government will clear all outstanding payments by June.
PFA is a fund that already is sitting at the Bank of Ghana. We have received funds from the TPFA for the private sector. So from where we sit, there's still audit going on the TPFA. The unions are still having discussions on a few issues that they do not agree with government on. And we are very, very positive, as the Deputy MD of the NPRA has said, latest by June, we should be expecting also that the public sector TPFA will be transferred just like the private sector has been done. Over 2 billion has been transferred to the private sector. So for us playing in the industry, we have no problems at all. We know it's only, like you rightly said, it's only a matter of time. And the NPRA has given us a deadline of June. And we are working very hard with the NPRA. What we need to do as administrators, we are doing it so that we can receive these TPFAs for the benefit of the teachers who have made this contribution.
Reporter for Joy News, Kwesi Debra.
You're watching Joy News today. We'll take a quick break. When we come back, I'll tell you what's been happening so far as Deputy Regional Ministers designate appear before Parliament's Appointments Committee.